Yeah. So we're live broadcasting as we speak. Thanks very much indeed, and welcome everybody to the Health and Wellbeing Board at the 12th of October here at our temporary venue, Rushcliffe Borough Council. I think it's really nice. It's got space. You don't feel quite as confined, and I'm told that the communication is better, that people can hear everything better. So I'm hoping you'll enjoy the afternoon. In terms of the agenda, this part of the meeting will be somewhere between 2 and 2:30, and that's the formal board part. And then we shall move to our second part of our hybrid, which will be, are we okay, Colin? Yes, sir. Yeah, which shall be a workshop on homelessness. So that is the Health and Wellbeing Board. And I'm going to go straight away to the minutes of the meeting on the 7th of September. And I'm going to go through those page by page. It was an exceptionally busy meeting, if I remember correctly. And I'm going to have a look and see. So I'm going to start off with page 3, which is page 1 really, or 2 of the meeting of the minutes. And if we go down to the chair's report, we'd be delighted to know that there is no chair's report today. But on that day, we talked about suicides, and on line 1, 2, 3, 4, it says there are 67,000 suicides in the UK every year. There are 6 to 7,000 suicides, not 67, in case anybody was alarmed by that. And you'll remember that that was around the time of World Suicide Day, which was the 9th of September. And since then, we've had Scott World Mental Health Day on the 10th of October. So that was the only change that I saw within the minutes. Going to page 4, combating substance misuse. Page 5, the joint strategic needs. Page 6, the wonderful targeted lung health check program. And then page 7, page 8, the pharmaceutical needs assessment, page 8, and then finishing with the Better Care Fund, etc. on page 9. So with the one correction of 67,000 deaths to 67,000 deaths, I'm going to recommend the meeting, the minutes, and ask for a seconder. Seconded by Councillor Scott.
Thank you, Chairman. I'll second those.
All those in favour? Fantastic. Adrian Mann, who's our new Democratic Services Officer. Very welcome, Adrian, this afternoon. And over to you for any apologies for absence.
Yes, so I have, excuse me, apologies, Chair, from Councillor Susan Shaw, Colin Pettigrew, Melanie Williams, Dr. David Briggs, Helen Smith, and Sharon Cadell. And Dr. Nicole Atkinson is slightly delayed, but hopes to be with us later. Thank you, Chair.
Thank you, Adrian. Item number 3, declaration of interest by members, disclosable pecuniary interest or private pecuniary and non-pecuniary interests. If anybody has anything to declare, now is the time to do it. Or if you think of something during the meeting and you wish to declare it, feel free to put your hand up and do so. So the one item really that is on this first formal part of the meeting is item number 4, which is securing a smoke-free generation for Nottinghamshire. And it was a fantastic workshop that we had, and any of you there will remember that I mentioned that this problem started in 1586 when Sir Walter Raleigh first arrived back from Virginia with tobacco, and has been a problem ever since. Smoking is now the main cause of cancer deaths and the largest preventable cause of illness, and responsible for 50% of every single bit of inequality that exists across Nottinghamshire. If you removed it in the morning and you halved inequality, people would say, why have we not done it before now? But better late than never, and we're going to start acting on it as soon as we get your approval. I'm going to go over to Catherine Pritchard. Where are you, Catherine? Okay, take it away.
Okay, thank you for that. So thank you for the opportunity of presenting today. The paper that you have in front of you is as a result of all the work that the board have done since the joint health and wellbeing strategy, where you identified tobacco as one of our key priorities, to the work that we did in July on the workshop in relation to tobacco. And today's a very pertinent day for us to look at this, because October is also known as Stoptober. And Stoptober is a national campaign that we've been involved with at a local level to try and encourage people to utilise our services that are out there. So we're doing this because over 1,100 of our residents every year die from smoking-related ill health. And that has an impact on both the individual families and members of the families, but has wider societal impacts as well. So it will impact on the economics of Nottinghamshire and our ability for people to work and enjoy long and healthy lives. And we know that those most affected live in our poorest communities. People who work in routine and manual workers are more likely to be smokers. People with mental health conditions are at risk of increased risk of smoking, and pregnant women in certain parts of the county. And we know the best way to control tobacco is that three-pronged approach that we've spoken about in our joint health and wellbeing strategy. So the first one is from a civic point of view. At a civic level, what can we do? And many of you will have taken things away from the workshop, signed up to our tobacco declaration to ensure that we no longer work, or that we don't work with the tobacco industry moving forward, as well as ensuring that our policies are safe and control tobacco. The second element is from a community point of view, so denormalising community. And many of our colleagues from districts and boroughs have worked on smoke-free public places to denormalise smoking, along with work from trading standards officers to identify people that are selling illicit tobacco. And the final part of that triangle is from services. What can we do to help people who are dependent on tobacco smoke? And we have freely accessible services available through Your Health, Your Way to enable people to access services, because we know that with behavioural support plus an additional nicotine replacement therapy, substance pharmacotherapy can help people to stop smoking. It's the most effective way. So I'd like to pass over to Jane, who's going to talk through what we actually did and the remaining part of what we hope to seek approval for today. Thank you.
Lovely, thank you. So I just want to start off by giving you a bit of feedback from the Health and Wellbeing Workshop, which was held on the 27th of July this year, where the board and partners considered how a smoke-free generation for Nottinghamshire can actually be achieved. So at the workshop, we covered the following topics and issues. So things like the scale of tobacco scale of the tobacco issue, both nationally and also in county. The establishment of a Nottingham and Nottinghamshire Tobacco Control Alliance, the findings of the challenge leadership and results clear process for Nottingham and Nottinghamshire. We talked about emerging issues like illicit tobacco. We also covered the NHS long-term plan work on the maternal pathway and also mental health inpatients pathway. We looked at lived experience by illustrating through case studies. We also had a summary of the CARN review, which was the independent review on smoking and making smoking obsolete. We also looked at the vision for Nottinghamshire, and we also provided an update on the tobacco declaration. And then workshop members reviewed the evidence in terms of the use of e-cigarettes as a quit aid. And attendees were actually provided with an opportunity to actually discuss e-cigarettes as a quit aid through group discussions. And groups were asked to explore 3 areas in relation to e-cigs, including clear and consistent messaging, understanding the government's direction on e-cigarettes, and the use of e-cigarettes as a smoking cessation tool. So the recommendations are that the Nottinghamshire Health and Wellbeing Board is asked to firstly approve and adopt the vision. And the vision is to work with our local partners to create a smoke-free generation for all communities in Nottinghamshire by 2040. The second recommendation is to sign up to the Nottingham and Nottinghamshire Tobacco Declaration and agree to take relevant action on smoking and tobacco, and for previous signatories to actually recommit to the declaration. The third recommendation is to commit to actions arising from the CLEAR process and the Nottingham and Nottinghamshire Framework for Action, which can be found in Appendix 2 of the paper. And the Framework for Action is based on the 7 key themes that have been identified through the CLEAR process. The fourth recommendation is to ensure partner organisations have identified tobacco-related outputs and also outcomes that they will deliver on, and add these to the organisational pledges as detailed in Appendix 1. And the organisational pledges, like Kath has already mentioned, are those civil level, community centred and also service-based interventions. And then last but not least, the final recommendation is to review and endorse the consensus statement on e-cigarettes, which can be found in Appendix 3.
Does that conclude the report?
Yes.
Yeah.
Thank you.
Thanks very much indeed. Again, smoking is one of those things, as I said, that's been around for an exceptionally long time. Everybody understands the risks. Nottinghamshire overall would be considered to be pretty good at 14–15% of smoking. But when you look at it geographically, there's a significant difference, as we normally point out, between the people here around us in Rushcliffe at 5.9% and those people who are up in Mansfield and Ashfield would be closer to 20%. So the variation across Nottinghamshire is what actually creates the challenge, not the fact that we couldn't sit back and say overall we look good. Those particular groups, such as pregnant women and the associated complications of smoking in pregnancy, are a target, and there is specific interventions in various areas around Nottinghamshire with regards to that. And of course, people with mental health problems. And if you go back to the 1960s and 70s, something like 60 to 70% of males smoked. 40+% of women smoked. If you look at the mental health population at the present moment, particularly those with schizophrenia and psychotic illnesses and those people who are in institutions, the same figures exist for that population as existed in the 1960s. 70+% of them smoke if they're men and 40 to 50% if they're women. So there are clear and obvious areas that can be targeted. There's clear and obvious groups of people that need intervention, and the greatest result of any intervention comes from targeting the people with the greatest problem. I think that's important. We did touch on e-cigarettes and emphasised enormously that e-cigarettes are not a place to start. E-cigarettes are not something that we want to introduce children to, not something we want to introduce adults to. E-cigarettes are a quitting mechanism for those already addicted to cigarettes, and therefore the idea that we're somehow creating a generation of people who vape who've never smoked is completely contrary to what we're actually doing. It's about harm reduction. It's 95% less harmful than smoking a cigarette, and that's the direction of travel in which we wish to travel and pilot, and have e-cigarettes available in our stop smoking centres, etc., and move down that way in order to complete that harm reduction. So I'm going to throw it over and ask if there's anybody got any questions around smoking, if anybody's got particularly any issues around it, anybody needs any update on it. I'm going to go. I thought you weren't here. You see, I couldn't see you. I couldn't see you, and I thought you're not here, but you are here. Yeah, press the button. Over to Councillor Wheeler.
All right, yeah, got it sorted.
Thank you, Councillor Wheeler.
Yeah, yeah. I'd just like to say big thanks to the meeting I had earlier. It's 1:30 prior to this meeting, so that I could sort of discuss the issues around e-cigarettes. Because I want to discuss the issues, particularly around children and young people who are taking up, because it's quite fashionable at the moment, but also concerns around adults who've never smoked that were picking e-cigarettes up. So I'm really, really pleased to see that the actual emphasis is on targeting those who have been smokers or for some considerable time or are smokers. So I'm pleased to see that within that. So I think that's really important that messaging is right and targeted at the right audience. So thank you very much.
Did you have any sort of prior statistics or anything around the number of people who never smoked who were actually taking it up, or was it just a general concern you had?
It was my general observation, because obviously I'm a youth worker on the ground, so I work with children and young people. So my observation is that, particularly over the last 3 or 4 years, I've worked with young people 21 years, and when I was working with young people 21 years ago, it was cigarettes predominantly that young people were smoking. So it was quite, a lot of peer pressure there. My concerns stem around the fact that a lot of children and young people are buying these cigarettes from a lot of the vaping shops, and they're not being challenged about it. And obviously, the county council has a policy of no smoking on premises, and you get young people coming to youth centres with e-cigarettes, and it's incredibly difficult. It's quite a challenge trying to challenge that, the issues around that. And I think that, which is why I'm glad I had that conversation earlier to express those views. But there has been, from what I've seen, quite a big growth in the amount of young people taking up vaping. I did a few years ago. There was one case where a young lad that I used to know, he had popcorn lung. So that's another observation I had. So there's all sorts of different health aspects that potentially could cause problems for children and young people as they're growing up. So I just needed to have that conversation.
And there are no long-term statistics because it's not a long-term thing. So we don't know what 30 and 50 years has in store for us.
Yeah.
We only know what we've got available today in terms of its reduction of harm.
Thank you.
Director Gribben, could you add anything to that?
I've got a comment, if I may, that sort of moves on from that, if I may. So it was just two things actually. It was to observe that in the framework for action, which is in Appendix 2, there's a number of actions set out there which apply to all of us, representing as we do our own organisations that form part of this partnership. So it was to underline that actually carrying this forward certainly is going to involve taking some of this back into our own organisations. For my part, if I, for a second, put aside my partnership hat and then put on my organisational hat, one of the conversations I'm wanting to take back into the county council then, following on from your questions about e-cigarettes, is what we can now do to exploit the potential that e-cigarettes do have in terms of harm reduction. Absolutely taking on board the importance of clarifying some of the messaging, and stepping up to the opportunity and playing a little bit of catch up, frankly, with how our commission services might play a part in that. There are still a few things for us to go through, but that's something I'm taking back into county council. I'm pleased to work with my councillors on.
So watch this space, Jonathan. That's what you said. Tillum.
Okay, so I agree with what's been said, and I fully agree with regarding the e-cigarettes. So, as a father of 2 kids, who's 14 and 11, and it's interesting, my eldest saying in schools vaping is coming around, and I see around, and I think it's 2 things which we've just got to make sure we don't conflate. It's the harm reduction using e-cigarettes that's really crucial, but my concern is, like you said, is we accidentally walk into another epidemic of, because you're right, there are long-term studies, but there are plenty of case studies where lipid deposition in alveoli are causing lung problems even at a younger age. So I think probably us collectively need to be a bit more proactive on this agenda, particularly access to vapes and e-cigarettes And I know while government regulation has to follow, I don't know what we can do, but there's probably as a partnership, we start thinking proactively, particularly discouraging younger and saying that it should not be misinterpreted as a safe substitute for smoking, because that's where commercial producers will latch on to and then push it out. It seems cool, and we don't want to walk into another epidemic few years down the line. So very much support what's been said. Thank you.
Thank you, Tillum. There is some reported cases, as you said, of what was called EVALI, e-vaping, acute lung injury, etc. Thank you very much. Go over to Councillor Wilmot.
Thank you. Yeah, it is a major. I'll start again. We have a major problem with smoking, and it's got to be tackled, and it's got to be tackled much stronger, and enforcement's got to take place as well. And everybody here represents a group of people or a group involved in this, and they all have their decisions to make, and hoping they'll make the right decisions. As I say, anxiety and stress and mental health is a major problem why people smoke, whether we like it or not. So we have to look at that issue and make sure that we're trying finding out these people before they get into a serious situation. I've seen it. I'm out there every day, walking the streets. I'm probably not doing the right thing walking the streets, but anyway, and it's all those related illnesses are making a real harm to everybody. The price. It's time that we looked at the price of the cigarettes and the price of e-cigarettes. We could automatically put the price up for the ordinary cigarette and reduce the price for e-cigarettes if that would help. And I'm sure it would, because everybody's telling me that it's much better to smoke the e-cigarettes rather than for your health and etc. So that would be something that we ought to look at. Enforcement. The police have got powers, but they're not strong enough. They're not strong enough. You have to be able to do things to make a difference. And at the moment, police powers are not strong enough to do that. Short, sharp lessons, yes. Years ago, I can remember information coming on the TV about showing people's lungs and things like that. Oh no, we can't do that. We should be doing that and letting people know, because that's where everybody's watching, all the TV, that straight after a football match or in between a football match. There's 8-9 million people watching, and they of course tell the people about the whole situation. We've got to let people know what illnesses that it can cause and how badly they'll be connected if they carry on. And we've got to stop making cigarettes so easily accessible. These are illicit cigarettes. They're all over the place. We've got to find out where they're coming from. It's obviously being imported. They're on boats. They're on everything. We've got to get a grip of that situation, because there's so many. They tell me some of these illicit cigarettes, they're sweeping up off the floor, which is an incredible situation that we're allowing the general public to smoke these. Because we haven't got enough situations to stop it. The other thing I'd got to say was, as I say, the support of using e-cigarettes seems now to be absolutely essential, because at least you will be doing something that can produce evidence that people will get not be so badly and so forth. And as I say, we've all got to start working much closer together. The NHS, the police, the councils, all together, because without a real big force behind everything, and everybody's working together, you won't do a thing, because it's so terrible. And of course, these issues about people wanting cigarettes and so forth, they're doing other things to get them. The antisocial behaviour, thieving from supermarkets and things. It's all part of this situation. So, as I say, we have a lot to do, but we can do it if we get all together. Thank you.
Thank you, Councillor Wilmot. It's a tour de force there of all of the provocative factors around why people smoke. And a lot of them will not be dissimilar to what we're going to go on to in a couple of minutes' time, which is the factors around homelessness and mental health and those exact factors. We'll all be keeping our eyes out now for you walking the streets, Councillor Wilmot. We'll stop and bring you a sandwich, and things like that as we go forward. There was a really good talk on illicit tobacco by Phil Taylor at our last meeting, and the deviousness with which people hid cigarettes. Extraordinary, where shops themselves are not even shops, they're fronts for illegal cigarettes. So all the things on the shelves, etc., mean nothing, because all of the money comes from the illegal cigarettes. But thank you very much indeed, Councillor Wilmot. Sheila, did you want to say?
Yeah, just a quick one. I have worries about e-cigarettes, because nearly every other shop now are doing e-cigarettes. Market stalls, you know, who's controlling what are actually in these e-cigarettes? Have trading standards looked into it? And, you know, I think tobacco's nearly been taken care of, to be honest. People know that they can get illegal tobacco things, don't they, everywhere? And I don't think you're going to cure them. My mother was one of them sort of people that had bought cigarettes from anybody.
Yes.
It's as easy as that. So
I'm going to come back to that in combination with Councillor Wildgust's question, and then we'll wrap up and move on to homelessness.
Thank you, Chairman. I spoke to you actually after the last meeting about this. Smoking is very, very close to my heart. I lost my wife through smoking. She died a few years ago. It's not how people imagine. Lung cancer isn't the way people think it's going to be. It's a very, very complex illness. Basically, there isn't much of a cure for it once you've got it. It's quite traumatic to live through for both people. You've got to remember that nicotine is extremely addictive. One of the things that we do tend to forget a lot. You know, there's also lots of reasons why, stress, what have you, but it's a very, very addictive drug. And one of my concerns with the e-cigarettes is that obviously you are giving a nicotine substitute. And it is potentially carcinogenic in its own right, but again, a lot lower than smoking cigarettes. My concerns long term are trying to wean people off the e-cigarettes, so in other words, creating another problem. But my only hope is that whatever we decide today, which I hope we will go with the programme that we've agreed, is that if one person doesn't have to go through what I've gone through and my wife's gone through, then it's worth it. Thank you, Chairman.
Thank you. I'll just take one more, Colin, and then we'll try and answer any of those. Councillor Guidewell.
This is more of a curiosity question, actually. We know that in Eastern countries, it would be a comparison between Eastern countries and Western countries. But Eastern countries have had vaping cafes for many, many years. This is just a new model for us in the Western countries. And one wonders if there is any actually comparable material to see how the differences between East and West, because it has been a part of life cycle within the Eastern countries. And it would be interesting to know if there is any information about the difference in ratios of addiction and things like this.
Yes, I'm going to ask if anybody will pick up the two things on the contents of vaping and how regulated it is, whether there are any comparisons with the sort of shisha type smoking areas. And just to recap, the point about lung cancer, and it came about by the lung cancer program going on up in Mansfield, where they had a mobile CT scanner, invited 10,000 people who were heavy smokers to come in, and they were picking up lung cancer at stages that they would never see clinically previously. They were coming in and there was no treatment available for them when they were clinically detected, but scanning was picking them up at levels 1 and 2, and the treatment, etc., was all there and life-saving. So the specialists themselves were amazed at the earliness which they were picking things up. And that's the whole ethos of prevention in a way. So over to you guys. Yeah.
So thank you for your questions and comments. It's very interesting to hear the sense of the room in relation to it. If I can just pick up on a couple of issues that people have mentioned. So firstly, in relation to the products themselves. So the products are regulated. They're not a medicine, but they are controlled by the tobacco products regulations. So there is a system and a process where legally produced vape products have to go through a system of regulation, but they're not a medicinal product. Interestingly, there is the facility now for companies to go through the Medicines Health and Regulatory Authority to enable them to be, or potentially, if a company decides to go for it, enable them to be a prescribed medical product. But at the moment, they do go through product safety testing and regulation. There are illegal products out there which won't have gone through that. So that's an important distinction that I think a number of you have raised. In relation to the illicit side, our trading standards colleagues we're working very closely with in relation to this area. And it was the first meeting yesterday of the illicit tobacco work that you will see in the paper that we submitted. So that's in relation to the products themselves. If I could just mention, Councillor Doddy, if it's all right, about the children and young people work, and something that we'd really value. If any of you are school governors or have contacts into schools, we do have a programme called the Intent Programme, which works with schools and therefore with children and young people around cigarette smoke and vaping. So if people are interested in that, please let either Jane or I know, and we'll put you in contact with them. We're really keen to roll out that programme. And I think the final thing that Councillor Doddy mentioned was in relation to East and West comparison. We know there's an increase, particularly in China, around cigarette smoking, and the tobacco industry is heavily focusing its marketing around China in particular. And shisha cafes, as you mentioned, have been around for many years. And one of the issues in relation to shisha is that people inhale more deeply, so therefore take in more potential carcinogens. So I don't have a direct comparison for yourself, but we know that is certainly an issue, and we're seeing a rise in Eastern countries. Is there?
Thank you. I'm not surprised that there's a lot of interest in this area. I'm going to stretch it just very short, with people's permission, just an extra couple of minutes. I've got Tillum would like to say something. Tillum?
So just very quickly on shisha, so we, as part of the targeted lung health check program, what we say is one shisha smoke is equivalent to 20 cigarettes. So that is, so anyone who's been smoking shisha gets automatically picked up with the targeted lung health check program. So that's what the evidence shows. So I just wanted to quickly add it out there.
Wow. Director Gribbin.
Thank you, Chair. I was wondering if I could just finish on two things. One was something of a call to action, and then the second was a note of well, more than hope, something that we can derive a lot of strength from. Several partners have commented on the addictive nature of tobacco, as we know. The way to tackle addiction is to prevent people taking up smoking in the first place. The sad fact is that in Nottinghamshire, each year there are still several hundred children and young people who start smoking. And that in part is because of the arrangements that we perpetuate. Some of those are under our control. The framework for action is one way that we can address those. So really there's something of a call to action there. We can stem that flow of people into the clutches of tobacco smoking. The second one was that I wanted to say was something from which we should derive a sense of hope and strength. And that's if we stand back and take a generational view and perspective on this. Part way up the mountain climb, it is worth looking back and to see where we've come from. And if you go back a generation and look at the even greater harm, death and disability caused by tobacco smoking, it was much greater than it is today. A lot of those gains have been realised through a number of things, not least through taxation and government level action, and also action taken down at a local level. So I think we should continue to look to some of those things going forward, but also do it kind of knowing that, wow, we've come a long way. We can keep going at this. There is some more to go at, Chair, as you set out at the start, but we shouldn't do it feeling in any way despondent. Thank you.
Thanks. I'm going to move on at that point to recommendations with just one last comment. We had a mention of Stoptober, and people who stop smoking for 28 days in October are 5 times more likely to continue to quit smoking than other people. And that is actually the most successful treatment that's out there. So I'm going to make recommendations with regard to it. Number one, to approve the vision to work with local partners to create a smoke-free generation, to sign up to Nottingham and Nottinghamshire Tobacco Declaration and agree the relevant actions, to commit to actions arising from clear the process across Nottingham and Nottinghamshire framework for action, to ensure partner organisations have identified tobacco-related outputs and outcomes they'll deliver on, and to review and endorse the consensus statement on e-cigarettes. So I moved that. Councillor Scott Carson, can I have a seconder?
Gladly a second that, Chairman. Thank you.
Thank you. And can I go to a vote? All those in favour? Excellent. I'm going to move very briefly on to work programme number 5. I'll remind people that Nottinghamshire Health and Wellbeing Board is the most industrious, the most hardworking board of any that are known to us, and that's proven by Brian here beside me. Whereas we would see 9 meetings a year, other people have 4 meetings and 5 meetings, and these combined meetings and workshops together, innovative, I would say, in that way, and that's how we get through as much as we do, and it's vitally needed. The next meeting is Wednesday the 7th of December and includes the COVID effect on the mental health of the population and also domestic abuse. So quite a lot coming up there, and that will bring us up to Christmas. So this part of the meeting I bring to a formal closure. I think you might have time to get a cup of coffee, and then we're straight into the homeless workshop. Thank you very much.